And now we're going to cover several bonus information, some questions and answers about heart disease in general, and also about some more issues regarding congestive heart failure. Now, many people need more potassium. Potassium helps kind of counteract sodium. If you have more potassium, you're more easily able to get rid of extra sodium. So for most people, many people, they need more potassium. It helps lower high blood pressure. However, you don't want to get potassium from potassium pills unless prescribed by your doctor. And you don't want to use potassium-containing salt substitutes, the so-called light salts, also unless recommended by your doctor. And the reason for that is that while many people need more potassium, there are some people who need to avoid getting too much. So for them, too much potassium could be dangerous. But on the other hand, again, most people or many people need more potassium. So people taking diuretic, we call them water pills, they may need more because those water pills, while they help get rid of extra water, they also get rid of potassium. So we end up, our bodies kind of run out quicker. But there are, on the other hand, some medications that make you need less potassium. So who are those people? Some people that need less potassium. So there's a couple medications out there. The most commonly is spironolactone or ACE inhibitors. You may need to avoid eating too much potassium. Now you still need potassium, but you don't want the really high levels of potassium because your body actually is holding on to potassium more than usual. Also, if you have chronic kidney disease, you may need to avoid eating too much potassium. And that's because the kidneys are the main ones that help monitor and decide how much potassium are we keeping, how much are we getting rid of. And when you have kidney disease, they don't do this job as well. So they may hold on to too much potassium. And that can be dangerous because potassium can cause the heart to not beat correctly. And it can also, actually, if it ends up very, very high, it can even lead to cardiac arrest. So potassium is in many foods, fruits, vegetables, nuts, beans, and dairy. So, but again, many people need more potassium, but it's just some people need less. So it's important to know which category you fall into. So what are some foods that are particularly high in potassium? This is certainly not a complete list, but it's kind of the heavy hitters. So bananas, prunes, potatoes, sweet potatoes, yogurt, milk, tomatoes, spinach, kiwi fruit, avocado, soybeans, pinto beans, actually beans of pretty much all kinds, pinto, kidney, black beans, and of course light salt.